Health authorities are investigating an outbreak of legionnaires' disease in Melbourne CBD, which has already left 5 people seriously ill. The Department of Health and Human Services is also investigating a possible 3 further cases. Almost 100 cooling towers are being examined in buildings across the east of Melbourne CBD, including 3 which the Health Department has already taken samples and disinfected. A further 89 cooling towers between the east of Elizabeth Street and Spring Street have been ordered to be disinfected as a precaution in case they were the source of the legionnaires' outbreak. All 5 people confirmed to have legionnaires' disease in the CBD outbreak required hospital treatment, but have since been discharged and are recovering. It is understood at least one of the victims required life support and intensive care before improving. Victoria's Deputy Chief Health Officer, Dr. Finn Romans, said another 3 patients were being examined for suspected cases of legionnaires' disease, however it appeared 2 may not be linked to the CBD cases. The 3 men and 2 women confirmed with the infections are aged between 51 and 71 years of age, and all reported working in or visiting the CBD in the days before they became sick in the last week of March and the first week of April. Dr. Finn Romans said interviews with the sick victims on Tuesday revealed the cases were linked to Melbourne CBD area. 5 cases is an unusual number of legionnaires' disease cases in Victoria in a short space of time, and it is very concerning, he said. The mortality from legionnaires' disease is concerning, it can be up to 10%. The symptoms of legionnaires' disease can take up to 10 days to appear after the initial contact with the bacteria. My message to people who have visited the CBD between late March and earlier this month and who may be suffering from pneumonia or flu-like symptoms is to visit their GP, who will assess the need for testing for legionnaires' disease, Dr. Finn Romans said. The department is continuing to investigate these cases to identify the possible source of their illness. Legionnaires' disease has flu-like symptoms such as headache, fever, chills, muscle aches and pains, followed by respiratory problems and pneumonia developing over 3 or 4 days. Those over 50, heavy smokers and drinkers, diabetics and people with chronic lung disease or lowered immunity are at increased risk from the disease. Cooling towers are the most common cause of legionnaires' disease outbreaks, with infections acquired by breathing in very fine droplets of water which contain the bacteria. The infection risk can be eliminated by decontaminating cooling towers after they were identified as a source. The Department of Health notification stated that 26 people have contracted legionnaires' disease so far this year, up from 21 notifications for the same period last year.